Hello viewers, welcome to Beyond the Shift Talk Show. I am your host, Grace Wanjohi. Today we are going to be discussing a concept known as stigma. Stigma and discrimination. So by definition, what is stigma? Stigma is a mark of disgrace associated with a certain attribute. It's a stain and it's also a blemish. It is seeing someone in a negative way because of a particular attribute like skin color or ethnicity. Stigma reduces a person from a whole to a discounted, tainted person. So today, when discussing stigma, I'll be discussing more of the medical field. Stigma has been associated with negative health-seeking behavior. Because someone is afraid of going to hospital and being stigmatized, they would rather not seek that service. So what happens? There is poor adherence to treatment, there is poor health-seeking behavior, and there is also poor health outcomes. Because this person has a problem, but they are fearing to go to the hospital because they know they are going to be stigmatized because of what they have heard from the society, and also because they may be suffering from self-stigma. They have already stigmatized themselves even before they reach the hospital. So that is what we are going to be talking about. Globally, stigma has been identified as affecting health-seeking behavior. Mental health issues are stigmatized. Some diseases are stigmatized in the medical field. And so once this person knows, I could be having this problem, they fear coming to hospital because they are fearing to be stigmatized, like it happened to so-and-so, maybe what they have read, maybe what they have heard. So what are the components of stigma? The components of stigma include labeled differences. When you're stigmatizing someone, first of all, you label the differences. This one is short, this one is tall. This one is brown, this one is dark. So you label the differences, then you stereotype. Dark people are like this, brown people are like this, short people are like this, tall people are like this. So you label the difference, stereotype, then you separate them from us. So as we are on this side, we are okay. They are on that side. So when you separate them, there is status loss. They lose their status because you have said, these are them and this is us. From the status loss, then there is discrimination. So you discriminate the services that you are going to give to this person. You discriminate them, you behave in a certain way because discrimination is behavioral. After you have separated them, labeled them, stereotyped, and they have lost their status, now you discriminate. And there are the issues of power and emotional reaction come in. So you are the one with power, so you decide what happens to these people, and there's a way you react to them emotionally. So you will not serve them with the way you're supposed to serve them because there is a degree of power, like they are different from us, they should not be treated in a certain way. And so remember, our relationship in the helping professions is about emotional engagement. Now here there's an emotional reaction which is discriminatory, which separates these people. So you're seeing people in a negative way. That is why we said it is seeing someone in a negative way because of a particular attribute. So those are the components of stigma. So what are the drivers of stigma in healthcare? The drivers include fear of infection. The healthcare worker could be fearing contracting an infection from the person they are serving, from the patient. Number two, inadequate PPEs, personal protective equipments. These are things like gloves, aprons, goggles, boots. So because of inadequacy of those PPEs, someone could also fear contracting an infection. Another thing is misinformation. Let's say there is an outbreak of a disease. Before you know the modes of transmission, you're going to be afraid to handle patients coming with that particular condition. So there is also social judgment. A person who is coming for antenatal care and is a young teenager You are wondering, why are they coming to the clinic? They are not supposed to be pregnant in the first place. So that is social judgment. Another driver of stigma among healthcare workers is authoritarianism. You are at a position of authority. When this person is coming to you, you are the one with the power. So you feel like you can do what you want with that power. You have the power to stigmatize, you have the power to treat this person the way you want. So these are some of the drivers of stigma in healthcare. So this person experiencing stigma, how do they experience it? What are the stigma experiences? One, there is internalized self-stigma. The person, even before they reach the hospital, they have already stigmatized themselves. Maybe because of the society, the way she or he has seen the society judging others. So there is internalized self-stigma. There is anticipated. So they are already anticipating, I'll be treated in a certain way because this condition is associated with stigma. Number three, there's perception that this condition is stigmatized. So there is also that perception that since this condition is stigmatized, I will also be stigmatized. And finally, there is associative stigma. After diagnosis, you have gone to the hospital, you have been told you're suffering from this condition. And out there, you know, people stigmatize this condition. So there will be that associative stigma, the stigma associated with a certain condition. So what is the impact of stigma? Stigma creates fear and removes the focus from the real problem. So instead of focusing on helping this person, you're focusing, let's say it's an infection you're fearing. You focus on protecting yourself from getting infected instead of focusing on helping the patient. Number two, the patient is likely to hide their symptoms because they know what they are going to tell you is stigmatized. They have learned that from the social judgment and social stigma. Number three, it prevents people from adopting healthy behaviors. Let's say a teenager gets pregnant. They will shy away from coming to an antenatal clinic because they don't want to be judged. So that is that impact of stigma and discrimination. And what is the overall impact? The physical, emotional, psychological, and mental health of the stigmatized person or groups is affected negatively. So those are some of the impacts of stigma and discrimination and the reason why it should be avoided. So how can we prevent stigma and discrimination in all areas, not just in the helping professions, not just in healthcare? How do we prevent? First of all, be kind to people, avoid judging people negatively, get facts. We talked about misinformation being one of the drivers of stigma in healthcare. Maybe you are not sure the mode of transmission of a certain disease and you are fearing that infection. Instead of that, do your research, get facts so that you know exactly how to protect yourself and handle the patient. Use the media to negate stereotyping. Advocate for correct use of social media so that people are not being bullied, people are not being stigmatized, even online. Avoid harmful labels. When you stigmatize a group of people or a person, there are those labels you give them and say this is someone who is suffering from depression, instead of those harmful labels that can prevent somebody from coming for help. Provide resources for the stigmatized groups. Let's say you're dealing with teenagers. There's a teenager who is pregnant. They are not going to be comfortable being mixed with people who are older. You can create a place for them. In the health sector, we have a place, especially in the public hospitals. We have what we call youth-friendly service clinics. Here, they can get all the services that they need. They can get family planning services, information on dating and relationships. They can get information on sexually transmitted diseases. They can get information about their health. If they are struggling in a certain area like body image, all that is catered for in the youth-friendly services. This one removes stigma because they're not going to be afraid. They know when I'm going to that clinic, I'm going to find people who are my age mates. And also the people who are serving them have been trained on how to handle the youth. Another thing that can be done is to name the stigma. If you realize there's something you're stigmatizing, name it so that you can research and get facts on it, like we have said. Have anti-stigma policies. Like if you are serving people in a public place, do not have like two lines. This line is for, or this queue is for people who are like this, and this queue is for people who are like this. Integrate the services that you're giving so that people don't feel stigmatized. Put them in the same queue, but know how to pick out if you need to help some people faster than the others, but do not separate them because this compounds the stigma. Those are some of the things we can do to reduce stigma and to prevent it. And in this way, we shall improve the overall services to our clients. So as I finish, I want to urge us in the helping professions to avoid stigma and discrimination, because we have seen it is one of the things that affects health-seeking behavior. So there are people who will stay at home simply because they are afraid of stigma. And in this way, we are getting poor clinical outcomes. This is not only to the helping professions. Try as much as possible in all spheres of your life to avoid stigmatizing people, avoid judging people, be kind and courteous to everyone whenever you can. So as I sign out, I thank you for listening to me, and thank you for continuing to subscribe, to like, share, and comment, and let us grow as a community for the helping professions. Until the next talk show, I've been your host, Grace Wanjohi. Bye-bye.